Okay, so let's get going. You've all been on here on time, so I don't want to make you wait much longer. Oh, well, hello from Victoria. Yeah, I'll let Alex take over. I'm just gonna make sure.
All good? Okay.
Can everybody hear Alex?
Hello, can you hear me? Okay.
Yeah.
Perfect. I hear some nods or see some nods. So I'm Alex. I'm really grateful to be here today with Tailgate ToolKit to give you guys naloxone training. If you guys haven't heard about Tailgate ToolKit before, we're a program specifically that's here in BC. We have regional coordinators with all of the RCAs in the province, and we do education and awareness and trying to end the stigma around substance use and mental health within the trades, transport, construction, forestry industry. One of the services that we provide that I'm doing here today with you guys, is the naloxone training. We also offer toolbox talks, so we go into companies, construction companies, trade schools, high schools with trades programs, and such, just to give an introductory conversation around mental health and substance use and what it can look like, where people can access resources regionally if they're struggling with mental health or substance use outside of work. We also have leadership fundamentals training that's currently under construction, but it definitely serves its purpose for the more higher ups in a company, like superintendents, like foremen and stuff like that, to kind of know what the rights and stuff are of people and the companies and stuff on around mental health, substance use. And we also have a support group. It's called Hammer Time from 7 to 8 p.m. via Zoom that people can access and be around peers who might also be struggling with pain management, mental health, or substance use, and maybe be able to talk to others that have been in the same boat or maybe struggling. So when I'm giving this presentation, if you guys have any questions, please feel free to interrupt me. I have some slides just to let you know a little bit about Narcanning and some of the information that's good to know. And then we'll be doing a little demo. So I'll put my camera down and hopefully you guys will be able to see me and do an actual injecting someone with naloxone using a sponge, so not for real. So yeah, if you have any questions, just let me know, but I'll get started. So yeah, I'm Alex. I'm the coordinator here for this region. Naloxone. So I'm not sure if any of you guys have ever Narcan someone, or this is completely new. So maybe it's a refresher. But it's a medication that quickly reverses the effects of drug poisoning, specifically from opioids or downers. So it doesn't work for certain substances, but it will work for classes of drugs that usually people use to kind of bring their systems down. So for example, heroin, fentanyl, morphine, all these listed here, codeine, oxycodone, and sometimes things like Suboxone and stuff like that. So it'll quickly reverse all the effects if someone has taken an amount that is going to make them unresponsive. Let's see if that switch slides there.
Oh, there it goes. Jump forward a couple now.
Yeah, it did.
Oh, there we go. Is that the one you're looking for?
I think so. Yeah. So this is a little graphic of what it actually looks like. So the tool substance will go into the receptors and take over there, and that's what slows the system down and stops people from breathing. And what naloxone will do once it's injected, it will quickly go into those receptors in the brain and bump out the opioid and replace it, and hopefully make someone become responsive. I'll talk more about the time and how long it might take someone to become responsive after they've gone down and become unresponsive. But that's kind of what it looks like, and to get an idea of what naloxone will be doing in someone's brain. Okay. It's important to keep in mind that if someone is not unresponsive due to toxic drug poisoning from an opioid or a downer, naloxone won't be harmful to them. So, for example, if someone were to inject me right now with naloxone, it would do nothing to me. So I'd be perfectly fine. It wouldn't work if someone is overdosing due to a stimulant drug like cocaine, methamphetamines, crack, ecstasy, anything like that. But it's important to know. So that's a lot of times why toxic drug poisonings happen is when one substance, like a stimulant drug, is laced with other substances. So I had someone at one of the trade schools that I went to who was smoking marijuana that was actually laced with fentanyl, which you don't immediately think that marijuana might be something that might happen to, but it does, because there's still people that access unregulated supply of marijuana, potentially people that aren't of age that want to go purchase it at a dispensary and things like that. So it does happen. So something to keep in mind, even if the drug isn't a downer, it can be laced with an opioid to make it stronger. And that's what, unfortunately, opioids can do to substances. They just increase its potency, and that's why people mix it in with other substances that they don't think that might have it. It's important to note that if you see someone that's unresponsive and then you go through the process of injecting them with naloxone, it might take a little bit longer for them to become responsive because of other substances besides like an opioid, for example, benzodiazepines. It's a type of depressant drug, typically used to treat anxiety, insomnia, and seizures. But what it can do when it's found in substances that people have potentially ingested and are experiencing toxic drug poisoning is longer periods of sedation. So when you inject them with the naloxone, it might take longer than for them to become responsive. What if it has benzodiazepines in the substance as well? So, for example, if it was a regulated drug supply that didn't have benzodiazepines, they might just respond in like around a minute and a half. If it's laced with also benzodiazepines, it might take them to 3 to 5 minutes. So something to keep in mind. Memory loss is something that people can experience as well when they become responsive because of this, because of benzos, as well as increased infection rates. And that's, benzodiazepines don't react to the naloxone like opioids do. So that's unfortunately what happens. And when you look at the information that's out there through the provincial government, they come out with people test their drugs. You see that there's a lot of benzodiazepines or similar substances that are found in drugs that people get tested before they use it. When you look at one of these kits here, which I'll let you guys know where you can access them, they look like this. What you'll find inside of them is 3 of these syringes here. So each kit, you'll be able to give 3 different doses to someone. You'll also find 3 ampules that look like this for 3 doses, again, because each needle you'll have to load it up with the actual naloxone. And then you'll find a mask, a pair of gloves, and alcohol swabs. Definitely practice safety when you are using, and if you decide to administer naloxone. I will say sometimes when people, in my experience, when naloxone somebody, I haven't used alcohol swabs because typically they're wearing clothes and I'll stab someone with the needle through their clothes. But it just depends on the situation. Definitely wear gloves and use a mask. You potentially might run into people that don't use a mask, but that's at their own risk. And I really highly do not recommend that because you don't know where this person has been. But the mask, it has a little valve where you just breathe through it and you place it over the person's mouth. Sometimes in first aid, if you guys have taken first aid, they'll actually give you a mouth breather thing. I didn't bring mine with me, but those are reusable. You can wash them and they're a little bit better, but you use what you can. These kits, you can find them. So if you're located in Victoria, you can come into the office and ask for me, Alex, and I can give you a naloxone kit. They're also available at most pharmacies that participate, and they're for free. So there's no cost associated with it at all. So it's something worth noting. When you're caring for the naloxone kit, it's important to know that they are sensitive to temperature and sunlight. So I wouldn't keep it in the car. I always keep mine in my purse, and just make sure you're aware of that, because it does make it does have the naloxone liquid in there, so it can react not in a good way, as in it won't be as effective. Naloxone kits will all have an expiration date here. And typically their lifespan is 2 years. I know that there's been studies done that years after that they've expired, they're still useful, but not as like potent as one that's still within its expiry date. So if you go to a pharmacy and hand the naloxone kit in, they'll give you a new one, and they can dispose of the naloxone kit the proper way.
What is the temperature range for, because we're going to be storing these on construction sites with our first aid kit. So overnight in a trailer, or like, how do we avoid that?
Yeah, that's a good question. I think in that situation they'd be fine. Like, it's more so like if you're like, for example, like I would keep mine in my glove compartment. Like, I can definitely get an exact number for you if you'd like. I have no problem with that, because I don't have the number off the top of my head.
Of course, because it does get like to 0 sometimes in Victoria.
For sure.
And then also in those trailers, it can go up to, like, I assume 110, right? Like with the sun on them. So I'm not sure they survive very well with us.
For sure. That's a great question. Not one I've gotten before. So I definitely will look into that, and I have no problem. Like, if you want that information, like I can, if you either want to send me like, a message directly, or maybe I can send it to Kyle and he can forward it to you, whatever works best. And I can ask, because I always try and keep updated. Like, I have contacts at Island Health, and they can give me like,
right, and maybe with some ideas of how to best store it then, if we have to store it that way.
For sure.
Like, does it need to be in a little steel case or something?
For sure. Yeah, no, I can, definitely find that out and send an email with that information for sure. And That's a great question that I haven't gotten before. And I love getting questions like that, because then if it comes up again, I'll know the answer. So thank you for that. So recognizing the signs of an opioid poisoning. So these are the signs to look for. So someone is not responding, they're not moving, can't be woken up. Their breathing is very slow, or they're just not breathing at all. So their breathing is slower than every 5 seconds. Sometimes they'll be making the sound. It's very distinct. It's snoring. It sounds like snoring, gurgling, or choking sounds. I'd say it sounds kind of more like choking sounds, but sometimes it can be very quiet. And that's when you go and approach someone, if it's safe to do so, you can put your ear next to like their head and try and engage for that. A big sign as well is blue lips and nails. Like, that's a very big tell, especially the lips. People's lips will be going blue. Cold, clammy skin, tiny pupils. Those are ones that not really my first go-to, especially the pupils, but definitely ones people can look for. Someone pointed out cold and clammy skin. Like, people might be like sweaty, so who knows if it's because they like that, or because it's a sign of being toxic drug poisoning. So just something to keep in mind. When administering naloxone, you'll have the acronym SAVE ME. There's a little sheet inside of the naloxone kit that has this acronym as well, that you can follow. And what it stands for is stimulating the airway, ventilate, evaluate, medicate, and then you evaluate again and support the person after if they become responsive. And I'll go into those a little bit more in detail. So when you stimulate someone, what you'll want to do is you'll want to shout near them. What I would do in the past is like kind of get near their head and just start like speaking very loudly and trying to, wake them up, obviously. as well as physical contact. So what you can do is, if you're comfortable, again, all these things, if you're comfortable in responding to an opioid crisis, is you can pinch the trapezius muscle right here, and that also is the pain stimulus that you can try and do for someone to become responsive again. If none of these things work and they are still unresponsive, then if you're alone, call 911 and put it on speakerphone. If there's someone with you, like they say in first aid, like point at someone and just tell them to call 911 while you are the one going through the process of naloxoning someone. When I use the words naloxone and Narcan, they're kind of interchangeable. Naloxone is the actual substance in the ampule, and Narcan is like speaking of the action of actually doing that. I just like to clarify because sometimes people ask me that. When we think of airway, so airway is checking if they're breathing normally, so 10 or more breaths per minute. If they're not, check for a pulse, tilt their head back and begin and check their airway, see if there's any blockage. That's why their gloves are in there. If there's any blockage, scoop it out with your fingers, go in and do that. And once that's removed, then you can start breathing for somebody. When you're ventilating for someone, keep their head tilted back. Again, safety, place the mask over their face and the valve between their teeth. Pinch their nose, give them 2 breaths and ensure the air is entering their lungs. So, look down, see if their chest is rising. Give 1 breath every 5 seconds. And breaths are more important than naloxone administration. So, for example, if you're going through this process and there's only 3 doses of naloxone in a kit, if you run out, the best thing that you can do in that scenario is keep breathing for someone, because that can keep the oxygen flowing through their body. And hopefully by the time you've given those 3 injections, emergency services have arrived and they can take over and they'll have more naloxone. Yeah.
Are you supposed to give 3 injections every time?
No. So sometimes someone might become responsive after 1 dose. That's why there's a waiting period after you give the first dose. It's around 3 to 5 minutes. And if the person doesn't become responsive in that time frame after each dose, that's when you go on to, okay, we need another dose. Yeah. After that's done, we'll evaluate. So check for responsiveness, check their pulse. Breathing, did any of the things we just did have the person become responsive? No, then you continue to give breaths, and then you would go on to administer the naloxone. If they do become responsive, then you move on to aftercare, and I'll talk about that a little bit later after these few steps. When we medicate someone or inject the naloxone, what you'll do is I'll do it here now. First, I'll explain it. How about that? We'll swirl the ampule around like this, or if you have a little surface next to where you are, you can tap it gently. I'll use my little kit here. You'll tap it like that, just to try and get all the liquid from the actual ampule to the bottom. Then what you're going to do is you're going to snap this ampule, and there's going to be 3 of them. And it takes a little bit of force, but what you're going to want to do is push away from you, hold the base of the ampule and push away, and then it'll snap cleanly off. So you're good to go there. While you're doing all these steps, you're going to want to also try and be ventilating for the person and giving them breath if you can. The camera down here so you guys can see. Once you've done that, so you see we snap this and it's clear. What you're going to want to do is grab the needle from your kit, one of the needles, and it'll look like this, and they're each 1 use. So you'll open it up, and what is cool about these needles is you'll know when all the liquid has been injected into the person, because you'll hear a click sound, and that's from the needle retracting back into the base of the syringe. Once you unsheath your needle from the sky, uncap it so you have the needle here. And then what I like to do is, you see there's like the little orange bit where the plunger, you want to just pull it up a little bit because they can be a little stiff. So that'll make it easier for when we go now to put the needle into the ampule to get all the naloxone into the needle. It'll make it easier to pull the plunger up and it won't knock over the ampule or anything like that. So once you have it uncapped, put the needle tip into the ampule and then pull the plunger up to get as much as the naloxone into the needle. Okay. So once we do that, take it out, flip the needle around, and then you're going to want to push all the air out of the needle. See, there's tons of air there. Push it up, and then like you see on those medical shows, push up the plunger until you see a little bit come out the top of, a little bit of liquid come up the top of the needle. So I'll do that. This will be going much faster when if you ever respond to an actual naloxoning. So yep, there we go. A little bit came out. What you're going to want to do now is you inject the person, and where you're going to inject them is either the arm, upper arm muscle here, or the upper thigh. Those are the two places to go. Some people have said the butt, but we don't do that anymore. You're going to want to do the arm or the leg. And then straight on, I like to do it as an angle, whatever you do at the moment. You're going to insert the needle and then push the plunger down until you hear a click. So do that. And that's it. So the needle will have retracted and you don't have to worry about it. So if you toss it aside, it's not going to hurt anybody until you dispose of it properly. And that's one dose of naloxone now that you've given someone. Does anyone have any questions about that? Or does anyone want to see any of that again?
Good, Alex. Maybe we could do it again if you close the slides. You might, just appear a bit bigger.
Let me just.
And that way, we definitely have one that's clear. I might even edit it a bit so we can.
For sure.
Just while you're setting up, are you going to be addressing what if this is done injected erroneously, like into a diabetic or a stroke or a cardiac patient?
Well, when you're responding to like an opioid or toxic drug poisoning, I mean, I don't know, like I'm not a medical professional, like in that sense. So like, if you're responding to someone that you might see, I don't necessarily know their, medical history. And after, someone's trained to do naloxone training, it's completely up to them whether they respond to that as well. There are laws that protect the Good Samaritan, for someone who decides to respond to something like this. That being said, you try and get the air out of the needle by getting a little bit to come out of the tip and do what you can, but you don't necessarily might not know the medical history of someone. So I can't really answer that question.
Is it harmful? You say it's not harmful to a conscious breathing person that doesn't have any impact, but if someone collapses and you misdiagnose because they're a diabetic or heat stroke or, and then you inject them thinking, oh, what did they take? Is that going to be harmful or is it just going to be a non-issue?
I can look into that. I want to say it's a non-issue because I've worked with a lot of individuals who have different health needs, like heart related, who are people that struggle with substance use, and they have been Narcan and stuff like that. And that hasn't been something that's come up, but I can definitely inquire about that as well and send that as well. My
concern with the guys on the sites, it's, they're going to witness a collapse, not necessarily because they're near the street. This is going to
for
be
sure,
reports, and if they misdiagnose, I don't want them to exacerbate a current medical condition because they misdiagnosed. So
for sure, and that's why you look for the signs. I feel like if you're working with people on the site, you might know them a bit better and right, okay, they might be someone who has diabetes or who has heart issues. Are they someone who is struggling with substance use? Maybe not. And that's why we talk about those signs that could be like a toxic drug poisoning, but sometimes it could mimic something else. So I didn't get an answer for you, but for the most part, I've not heard naloxone like in someone getting injected. There is also nasal naloxone that might be an option. It is a little bit pricey, but just something to keep in mind as well. I can look into that and send that as well in my follow-up email.
Thank you.
I'll do another one of these guys here. Okay. We'll do this guy one hit here. What you want to do first, swirl it. Okay. Tap, make sure you try and get as much as you can to the bottom. Grab it by the base here and then push away from yourself to snap it. Okay. Should come cleanly off. Then you're going to want to grab your needle here and take it out. I can take it out here. Uncap it, and then again, if you want to, you can take, uncap it. And if you want, you can pull the plunger up a little, so it just makes it easier to now do that when pull the plunger up when you're trying to get the naloxone liquid into it. Put the needle tip into the ampule and just start getting the liquid into it by pulling the plunger up. And then put the needle upside down and start pushing the air out, and then push it out until you see a little bit of liquid come out here. The tip, I know it might be a little bright because my shirt is white, so I'm sorry about that. So a little liquid came out there at the tip. So now you know it's ready and you got the air out. Then you'll just insert it into the person's upper leg, thigh, or their upper arm, and then push the plunger down till you hear a click, and that means that it's gone.
Cool.
Okay. Alrighty. I will get these slides back up here for us.
Okay. Do you have a few more to go through there, or?
Yeah,
Okay,
just a couple
perfect.
more.
I'll leave this way so Crystal can see it still then. Oh,
There we go. So where we were here. Yeah, like I mentioned, nasal naloxone, it's available. Unfortunately, it's a little bit more pricey. I have a limited supply that I might be able to give people if they come into the office and would like some. But if someone's a status First Nations person, they can use their status number and their personal health number and get a nasal naloxone kit for free. That's something definitely to be aware of.
you said, Alex, you could go to the other RCA offices as well?
Not
Not necessarily for nasal, but
Yeah, for injectable naloxone, each coordinator has these kits.
Okay.
So people can definitely reach out to them first, and let them know they're stopping by, or make sure that the actual coordinator is at the office at the time, because we do travel sometimes, and they'll have it ready for you to pick up there, or again, local pharmacies typically participate. So definitely reach out to Tailgate ToolKit if you're interested, and we can see what we can do.
I'm going to post links to the RCAs and Tailgate Toolkit there so people can.
Totally.
How many
There we
could we
go.
pick up, or should I go to different pharmacies and collect enough?
What's that?
How many can we take? We have 5 sites, I think, or 4 sites with fully stocked first aid kits that we'd want them at.
I mean, I don't know how many pharmacies keep, but I have tons. So like, I don't know how many sites like that would be, but like I've gone to, when I've given the naloxone trainings, I've taken like 20 kits, 30 kits at a time. And if I don't have enough and I need to order more, which I don't think would be the case right now, I can just order more. And if you wait, get them that way, or it's just a matter of how many our actual pharmacy has at the time. So I don't know what their stock is. So
Thank you.
yeah, you're welcome. We're just gonna sip here. So yeah, once you've administered naloxone, you're going to want to evaluate and do that whole thing again. Like I said, because of benzodiazepines, 3 to 5 minutes is typically how long you want to wait before you administer a second or another dose of naloxone. Okay. So if they're not breathing, continue to give breaths and then move on to another injection. If they are, then you can move on to aftercare. Yeah, benzos might be in there, so it takes longer. So just remember that more than 10 breaths per minute and improving color is a good sign to see in people, especially with the improved color, like the blue lips, it's crazy. That always would shock me when I would respond to something like this. So definitely a telling sign. Put the person in recovery position. If you guys have taken first aid, I'm sure you know what that is. So on their side, so if they do end up throwing up or anything like that, it's not going to choke them, and they're able to support themselves if they're in the recovery position, and they're easier to maneuver. If it's safe to do so, depending on who you are responding to toxic drug poisoning, whether maybe it's someone you know, or maybe it's you decide to respond for someone you don't know, that's someone from the street community, whatever that may be, it's important to be aware of how sometimes people are agitated when they come to. So it's important to keep yourself safe and only do what you're comfortable with. If the person doesn't want your help, or anything like that, then you've done what you can. They're responsive. If they don't decide to go to medical services and get medical attention for follow-up, that's their choice. You've done what you can, but it's important to remove yourself. They might experience withdrawal symptoms as well if they do come to. So that's something like someone could be experiencing when they become responsive. For yourself, when I'm presenting this, it might not seem like a lot, but it really is. Like, if someone decides to respond to toxic drug poisoning by Narcaning someone, adrenaline kicks in. And then when that adrenaline leaves, well, you're going to be kind of exhausted, in my experience. So definitely check in with yourself and check in with someone that you're comfortable with to make sure that you're okay. Disposing of the needles, a sharps container is probably the best. So if there's one available, that's awesome. If not, an empty water bottle, put the needles in there and the glass from the ampule. And if you throw it in the garbage, it won't hurt anybody because they're in the plastic bottle. And yeah, that's all I got for you guys. Any questions at all?
Additional questions?
Yeah, I should say.
Oh, Stacy.
I have a question. So you mentioned administering the mask, and could you explain that a little bit better? Do you put the mask on yourself or on the other person?
No. So I'll show you here. It's on the other person, I should say. So it's not on yourself. So the mask looks like this. Some of them will have a plastic bit on the mask, which that's what you put in the other person who's unresponsive. That's where you put that on. But let me open one up here and show you guys.
Can you make it big again?
Yes. Let me stop sharing this guy here. Oops. You don't need that. So some of the Narcan kits come with, like I mentioned, one with a plastic bit. That's what goes in the person's mouth. Or there's other ones, the ones that I currently have. This is the barrier right here. So you'll put that on the person's face. So it'll be like right here. And that's where you're breathing through. And that's the barrier that the masks in the kit provide. But this would go on the person that's unresponsive.
And sorry, does it like stick on, or do you kind of just like place it
It's
there?
just when you put it on there, there's no sticky factor. So when you're like close to someone, you'll be also like both your hands will be like keeping it in place. Sorry, it's hard to like show you. But if you see the little picture there, the person's also like holding it in place a bit. And you do the best you can with the materials that are given. And yeah.
Thank you.
No problem.
Excellent. Well, if there's no other questions, we'll end it there. I